And I noticed that you mentioned you're having a guest talking about root canals.
Mm-hmm.
That's a show that everyone needs to listen to,
Mm-hmm.
because root canals are almost the cause of about 2/3 of what walks in the door from people that have been to 5 different doctors and no one knows how to fix them. But
Mm-hmm.
I'll let your show on Friday talk to that.
Yeah, that's Dr. Gerald Smith, and he's doing a lot of great work on root canals. And I've got a root canal myself, and I'm in the process of figuring out how to get rid of that in a safe and effective way.
You need to pull the tooth. If you've got a tooth that was able to die, the
Mm-hmm.
secret is not to embalm it and leave it in your mouth. The secret is to pull it and clean out the socket. Because
Okay.
what happens is you get an autoimmune reaction against the chronic infection that the root canal causes. And that's the cause of most of the things that we deal with.
Mm-hmm.
And the way to treat it is small amounts fix what large amounts cause.
Mm-hmm.
If you have a known problem, you use a dilution of it, and it triggers the immune system to undo the problem. And you not only have to use the same thing that you find, you use something similar to it. That's the secret of homeopathy.
Okay.
We can talk about.
And just one more thing on the root canals. Have you heard that there's some sort of lowering of the immune system just by having one root canal? I believe I forget what percentage it lowers your immune system, but it's an incredible amount, isn't it?
Well, let me just tell you that, I see the path reports from the removal of the infections that are underneath the root canals. I mean, they find as many as 12 or 13 different bacteria and viruses in a root canal tooth.
Wow.
And when the immune system is being challenged to fight 12 or 13 different infections, that lowers and destroys your immunity tremendously. And that's where a lot of chronic illness comes from.
Wow.
And the thing is, you need to then go to the next level. Every tooth in your mouth sits on a different acupuncture meridian.
Mm-hmm.
And all the teeth in your mouth, I have a chart in my office that was created by Dr. Vole, who's one of the heroes in our world. He passed away probably in the 1950s,
Mm-hmm.
but he's one of the fathers of the fields of integrative medicine. I mean, every tooth is connected to a different organ. And I have people that come in and they tell me their problem, and I say, do you have any root canals in your mouth? And I got to tell you that 80% of them will say, yep, I got one. And I say, which tooth? I said, wait, let me tell you which tooth. I said, what's wrong with you? And then we go in and we look at the chart, and it turns out they're having liver problems. So the third tooth from the midline is called your eye teeth or your liver teeth. And you go in there and you find out they either have a cavity or a root canal in that tooth. Mercury fillings are almost as bad as root canals, and they have corroded fillings. And we do a process in our office called thermograms, which is a heat-sensing imaging device.
Mm-hmm.
And you look on the thermogram and you see that they've got a red or a hot spot right where that root canal is. And that's when you send the patient to a biological dentist. I mean, the guy you're having on the show, if he really calls himself a biological dentist, is part of an elite fraternity of only about 100 of them.
Mm-hmm.
And that's how many there are in the whole United States. I've never had a root canal, but I ended up having wisdom teeth extracted that created what's called cavitation infections, which is what you get from root canals. And it like lowered my blood pressure. It was on my very back teeth, which are the teeth connected to the acupuncture meridian that goes to your heart. And it changed my life. Really, really did, just by cleaning out a socket of a tooth that had been allowed to fester and cause a jawbone infection.
When you talk about the dangers of root canals that have happened over many, many years, are there safer alternatives now if we're in a position where we need something like that, where we have a dead tooth?
Very definitely, yeah. I'm giving a talk in a few months called Advance to the Rear, because in the past there was a technology that took care of those problems. It was called extraction. I mean, if you've got a ruptured appendix, you're going to fill it with wax and put a gold crown on it? You got the same bacteria there, only the ones in the mouth may be worse. You remove it. And then the thing I can't understand, patients 50 years ago understood if you had a tooth removed, you have a partial denture, you have a bridge, you have something put in there. Today, almost anybody that I mentioned, root canal teeth, do root canal teeth, the question is, do all root canal teeth have to be removed? And the answer is no. Only in those people who are interested in their health. If they're interested in their health, they can do what we did 50 years ago. Take the tooth out. Only dentists are taught to leave the membrane, the periodontal ligament, in place, in the bone, which is like delivering a baby and leaving the placenta in. Not good. But if you do it properly, if there are a series of procedures that need to be done, you don't just take hold of it and yank it out. A few other procedures, because as soon as the dentist touches the tooth with cold steel, which means the forceps, bacteria in the bloodstream going where? Every place blood goes. You poke your finger, you get blood. Big toe, you get blood. So it can go anywhere and everywhere, and does. But the bacteria have something called chemotaxis. It's a magnetic attraction, a fatal attraction, if you would, for specific tissues. Some bacteria like the heart, some like the liver, some like the lungs, some like the brain, but they have access to the whole body. So if you're interested in health, you don't just go to a dentist and say it hurts and take it out. But this kind of leads up to a case I was involved in not too long ago, where a fellow had his root canals taken out and he had some plastic temporary bridges put in. And this was done in another country, actually. And one tooth kind of began to get a little sore. And I said, okay, close down very, very slowly. Where do you hit? Well, on that tooth first. I said, okay. So the temporary is a little high. It takes the dentist, and then the teeth will come together the way they're supposed to. So I called a dentist I knew, and I said, would you just adjust the bite there? Yeah, sure, fine. Send him in. That's okay. So he calls for an appointment. And the secretary says, well, what ails? Well, I got this tooth, it's kind of sensitive. And I bite down and said, oh, you need a root canal. I'll go ahead and schedule you for a root canal. Well, he had just had 5 root canals taken out because he had some real severe problems and he was coming out of them, and he understood very well that the root canals had created these problems. There is no way he's going to get a root. He says, no, I think the bite needs to be adjusted. He says, no, I'm quite sure you need a root canal. Go ahead and come in and see the doctor and we'll do the root canal. So why do we need root canals? Quota. That's not very diagnostic when a secretary on the telephone says, you need a root canal, I will schedule you for it, and the doctor will do it whether he looks in the mouth first or not. It's just, am I getting a little biased there? I guess I am, because the only people I talk to are the ones who have problems and who did not have problems before they had the dentistry done. So my objective now is to inform the public, because I did inform the Dental Association about mercury, and that seemed to alter my life a whole lot. And I'm not going through that again. They took everything I had. I don't have anything to lose now, so I'm not afraid to tell the truth. I was interviewed by a religious station not too long ago, and the guy said, do you mind if I start the program off with a prayer? I said, no, that's fine by me. I know the guy up there. He's okay, so you can talk to him. So he gave this prayer, and it ended with, teach us that, what is the quotation? Something about, find the truth and it shall make you free. And I said, do you mind if I add the Huggins twist to that? And he said, no, go right ahead. And I said, speak the truth, and it sets you in the crosshairs. So this is what I am beginning now. having a massive amount of data instead of just 12 cases that I took to the Dental Association. I have a massive amount of data now on the frequency at which these bacteria are found, the data from the literature that explains what these bacteria do, and connecting the blood chemistries, the symptoms, and the dentistry. And then we have developed a technology that's a little bit complex. But 40 years ago, I made a lot of mistakes in trying to treat people for dental toxicity. I don't make those mistakes anymore. I teach dentists how to do it without making those mistakes and using the blood chemistry as a guide to how do you treat the patient. Is there a specific treatment? Yeah. From Tom, Dick, and Harry, we have 3 different treatments. Who tells me how to do it? Their blood.